Hi there, good afternoon. Welcome to our taste today here at Montfort University, and hopefully you're looking forward to finding out a little bit more about pharmacy. My name's Helen Root and I'm the programme leader for the pharmacy course. So thank you for joining us, albeit virtually today. Throughout the session today, you're going to meet a lot of the team, and some people are going to talk to you about their careers, about the things that they teach whilst they're here at the university, and there's going to be an opportunity for us to show you what it might be like to be a student here, but also what opportunities are available to you as well once you qualify as a pharmacist. So we hope you find the session really helpful today. We're going to end the session with a question and answer session. So please do capture any questions and thoughts as you go along. You'll see that there's a comment section and we'll be monitoring that and we'll pick those up towards the end of the session. So please do ask any questions that you might want to as we go through. So before I move you into the first session, which is going to be nice and interactive, I'm going to get you to kind of think about a patient. I'm going to just introduce you to Professor Susie Walsh, who's our Associate Head of School, and she's just going to say a quick hello to you all.
Oh, thank you, Helen, and hello everyone, and great thanks for joining us today. It's really great to see so many of you joining. Really pleased that we're able to have this session, and I look forward to answering your questions later in the question answer. So if you've got anything you want to know, be it about admissions, studying, a bit more about DMU, anything about the course, pop them in the chat and we can come to them later. And hopefully we can answer everything that you're thinking about or maybe concerned about, worried, anything you like, we'll try and answer them. So great to see you all, and I'll see you in an hour or so.
Brilliant. Thanks, Susie. That's great. So to begin our session today, I'm going to introduce you in a moment to Ryan, who's one of our pharmacy practice team here at the university. And he's going to introduce you to a patient who's called Mr. L. And he's recently been admitted to hospital. And so what Ryan's going to do is talk you through what we think might be wrong with him and how we might want to treat him, and so the kind of care that you might be involved with this particular patient. Once Ryan's finished that session, we're going to ask some more questions and we're going to get you to interact with us a little bit more. So make sure that you're really listening as you go along, and we're going to find out a lot more about Mr. L. So Ryan, I'm going to hand over to you now.
Brilliant. Thank you, Helen. Good evening, everyone. Thank you for joining us. So as Helen says, I'm a member of the pharmacy practice team here at Montfort University. But I'm also what we call a clinical academic pharmacist. So I'm at DMU 3 days a week doing research into infectious diseases and the best use of antibiotics. And I spend 2 days a week at Kettering hospitals as their lead pharmacist for microbiology and infectious diseases. And you'll come across quite a few members of staff like me at your time at DMU, where we spend time in practice and also in academia, which is really good for you guys because we get to bring our real life practical experience to help you with your learning and development. So as Helen kindly introduced, I'm going to be talking today about a patient called Mr. L. What I'm going to do through this case is not just focus on the clinical aspects of the case and how pharmacists can support patient care, but also how pharmacists can be leaders in patient care and how we can make real impacts on patients' lives. During your time at DMU studying pharmacy, you'll cover a lot of topics like chemistry, dosage form design. So that's how we get a drug molecule into something we can give a patient like a tablet. And I'll also introduce things like physiology, microbiology, and psychology as well around patients. So there's a lot of skills and knowledge you'll gain during your time on the pharmacy course, and they're all really important for pharmacists to have to support and help patients with their care and their health. Can I have the first slide, please? Thank you. I'm going to be doing a Chris Whitty, so I'll be doing a next slide, please, when I need to. But this is Mr. L. So he's a 78-year-old man who's been admitted to our respiratory unit with an infective exacerbation of COPD. Before he was admitted to us, he had developed a cough and there was thick purulent sputum, so that's a kind of greeny, thick, sticky sputum, and that had developed over the last 5 days. And he'd progressively become short of breath. He was struggling with how far he could walk, going upstairs. And he felt more and more unwell, and he became dizzy yesterday. So his wife, quite rightly, was worried about him and brought him into urgent care. In terms of his background, he's had COPD for 21 years. So COPD stands for chronic obstructive pulmonary disease. So this is a long-term condition. It's not something we can cure, and it's different to asthma. So you've probably heard of asthma, where we can give people inhalers and it opens up the airways and we relieve their symptoms. COPD is different in that the disease isn't as reversible as we call it. So whilst we treat it with inhalers, there's no cure, and it just progressively gets worse over time. And unfortunately, patients, as their disease gets worse, get more of these exacerbations. That's an acute or a quick worsening of their disease, and that's what we've got here. And unfortunately, Mr. L has had 2 of these exacerbations over the last 6 months, so we can assume that his disease isn't as well controlled as we might want it to be. Before he came into us, in terms of his background, he lives with his wife, so he's got some good support there. And as you can see, she's the one that brought him into hospital. Men, we're not very good at looking after ourselves. And when we are, when we're not well, we don't seek the help we need to. So thankfully, Mr. L's wife looks after him, and she was able to bring him into the hospital. He's also got 2 pet budgies to keep him company and to give him something to do, because as you can see in his medical background, his exercise tolerance is what we would say is 100-meter exercise tolerance. So that means he can't really walk more than 100 meters without getting out of breath and having to stop. So that's really limiting what he can do in his day-to-day life, and he struggles to get out to see friends, go to the pub and see family. They all have to come to him. He does go to church on a Sunday, so his wife will drive him, and his faith is really important to him. He used to work in a supermarket. He's now retired. He's enjoying his time in the garden, but he still smokes. So he smokes 10 cigarettes a day. It doesn't sound like a lot, but cigarette smoking is essentially the primary driver of COPD, and it's probably his underlying cause, and his smoking isn't going to be helping his disease. And as pharmacists, it's really important for us to understand the social background of our patients, because we can give Mr. L all the inhalers in the world that we have available to us. We can help him with his exercise and breathing techniques, but if he doesn't stop smoking, then his disease is going to get worse. And community pharmacists, we are placed really well in like locally to people's homes to help them to stop smoking, around like giving them patches to help them with the psychological impact of cigarette smoking. We can also help patients with their medicines. So this patient's on 2 inhalers, and they are used differently. And it's really important for pharmacists to understand how different medical devices are used. So how is that inhaler inhaled, essentially? So is it a slow inhalation or is it quick inhalation? So as hospital pharmacists and as community and GP pharmacists, we need to have a good understanding of how those medicines are used so we can educate our patients. So whilst he's in hospital with us, we also need to make sure he can use his inhalers when he goes home. Can I have the next slide, please? But what we want to focus on at the minute, because he's acutely unwell, is the treatment of the infection. And when a patient comes into us, we don't know exactly what microorganisms are causing that infection. So we need to take what we call a best guess approach, or we need to start smart. And we do that by having a good understanding of the microbiology of these infections. So chest infections in COPD can be caused by bacteria such as Streptococcus pneumoniae, which is the most common one. But because he's got COPD, he's also at risk of other bacteria such as Haemophilus influenzae. And because he's got budgies, we also need to consider whether he's got a rare bacteria called Chlamydia psittaci. There's obviously viruses. You'll all have heard of flu, and you'll all have heard of SARS-CoV-2. You're probably fed up of hearing about it, but this is a disease that's not going to go away, and it will impact on your practice when you qualify. Because he's got this chronic condition that's characterized by thick sputum and chronic infection, he's also at risk of fungal disease by Aspergillus. Because we have to come with a best guess approach, we don't necessarily need to treat every single one of these organisms all at once. what we'll do is we'll start Mr. L on amoxicillin, which is a penicillin-based antibiotic, and that will treat the Streptococcus pneumoniae, and it will also treat the Haemophilus, which are the most likely causes. During your course at DMU, you will learn about the physiology and disease processes, and what we can tell from Mr. L's history is he's unlikely to have a disease like influenza or COVID, because he doesn't have that cough, he doesn't have the fever, and he doesn't have the muscle aches that you would get with a viral infection. So we can pretty much assume this is likely a bacterial disease. So we can focus on just giving antibacterial therapy. On your pharmacy course, you will also learn a lot about chemistry, particularly pharmaceutical chemistry. So I've given you what I call, when I do my teaching on the course, I call these naughty pictures, which are molecular structures. And I've highlighted there in blue the beta-lactam ring. And those of you doing A-level chemistry will know that this four-membered ring is incredibly strained and it can snap open really easily. This can be a problem for giving patients medicines because it makes them less stable. So we need to store them in the right way. It means that they break down more in the body and in the stomach. So that ring can be hydrolyzed by the acid and the water in the stomach. So you get less drug absorbed into the body. But this is also really important for the way it interacts with bacteria. So there's an enzyme in the bacteria that builds the cell wall. And what the penicillin does, this four-membered ring, is it snaps open and binds the enzyme and prevents the bacteria from creating that protective wall. And it kills the bacteria, which is a good thing. This is also the mechanism by which penicillins cause an allergy, where that ring snaps open and it joins onto another penicillin molecule. Its ring snaps open and you get these big bundles of molecules and the body reacts to it. And there's a lot of problems at the minute with people being labeled with penicillin allergies. But what we can do as pharmacists is we can educate people that it's not just about that ring, it's about the whole structure of the molecule. And we're really well placed to encourage prescribers and patients to try different types of penicillin antibiotics if they've had a mild reaction to one of the others. Next slide, please. So once we've started treatment and we've got all our other test results, we need to try and identify what the causative microbe for the infection is. One of the traditional roles one of the traditional ways of doing that in a chest infection is to take a sputum sample and to spread it on a plate like we've seen here. And we've grown Haemophilus influenzae. So we can say that our treatment should focus on this. And that allows us to select the best antibiotic for the patient in terms of him, and also in terms of where the infection is and what bugs that were growing. I've also put a picture on there on the right-hand side of a PCR testing machine. And you've probably heard of PCR testing in relation to COVID. And you probably might be surprised to hear that over the coming years that pharmacists are going to be more and more involved in these types of rapid testing. So this is a rapid PCR testing machine here. And pharmacists are keen to get involved in testing for diseases and infections in the community pharmacy and also GP practices. So what we'll do in the pharmacy course is we'll tell you and teach you about these different diagnostic techniques so that you have a good understanding for them ready to go into practice. Can I have the next slide, please? So once we've identified the organism, we need to make sure that the therapy is working. And pharmacists are involved in reviewing patients' medicines, after they've been newly started, and particularly with antibiotics, we try and review these within 2 to 3 days of starting them. And when we do that as a pharmacist, sometimes we find the patient's not doing as well as we'd hoped. So they might not be getting better at all, but some patients get worse on the antibiotics that they're taking without any real reason. We're giving them the right antibiotic for the right dose, surely. But as you can see in the picture there, on the left-hand agar plate, there's loads of clear zones, and that shows that the antibiotics we test against the bacteria are working. But on the agar plate on the right-hand side, those zones have gone, and there's only a couple of small ones. And this is because the bacteria has become resistant to the antibiotics we're using. And we're in a real predicament now where we really are at risk of losing modern medicine, and we're at risk of having infections that can't be treated by any antibiotics. And pharmacists are really well placed to protect these medicines for the future and make sure we're using the right ones and prevent this emergence of resistance. As pharmacists, we also need to understand what we call the mechanisms of resistance. And when we detect a resistant bacteria, what alternative medicines can we use? And an example of this is cormoxiclav, where we have a secondary smaller molecule that competes for the destructive enzyme. And this is an enzyme that breaks down penicillins, and we can block that pathway by adding in another molecule. So pharmacists are really well placed to optimize medicines, to chase prescribers and nurses to say, look, this medicine isn't right for the patient. We need to do something different, and making that recommendation. So not just stopping at saying something's wrong, but coming up with a solution. So we'll change our gentleman's treatment to cormoxiclav and give that intravenous just to make sure we get good effect. Can I have the next slide, please? So he's getting better, which is great. But we can't keep him in hospital forever. He wants to get home. He goes to church. He's got a family. He's got budgies he's probably missing. I can't bring them into the hospital. So what we can do as pharmacists is we can optimize his therapy. So what we'll do is we will change his intravenous therapy to an oral capsule called doxycycline. And instead of switching him to oral cormoxiclav as a tablet, I chose doxycycline because the testing shows it works on the Haemophilus. It's narrower spectrum, so he's less likely to get side effects like diarrhea. It's less likely to induce resistance in other bacteria that live on his body. And it's a once-a-day medicine as well. So instead of giving him a medicine he has to take 3 times a day and space evenly apart, and that can be quite difficult for some people to handle. If we give him a tablet that's once a day and it's just in the morning when he gets up, it's going to be easier for him to take, and it's going to be easier for him to remember and finish his course. There's other reasons that we might change people's medicines as pharmacists. So capsules can contain things like gelatin. That's not appropriate for people who are vegetarian. And the pharmacist is really well placed to really understand what that medicine contains and tailor it to the individual patient and make sure it works for them, and not just treating people as numbers, but really looking at them as a person. Whilst I've got you, obviously I'm an infectious diseases pharmacist. I would encourage you to scan the screen with your phones now on the QR code and visit the Antibiotic Guardian website. Have a look at the risks that overuse and misuse of antibiotics are causing, and think about how you as the future pharmacist can impact on slowing that down. And you can even come up with a pledge and sign a pledge to become an antibiotic guardian even before you start your course. But yeah, thank you for listening. I hope it gives you a good understanding of the knowledge you'll get on the pharmacy course and how you can apply that to patient cases and really make a difference to patients' lives. Thank you.
Thanks, Ryan. That was brilliant.
Thanks, Helen.
Okay, so what we're going to do now is you've had a chance to meet Mr. L, and we want to ask you a couple of questions, and we want to get interactive. So next slide, please, Josie. Thanks, Fab. So as you can see, we've got something here that's called Mentimeter. It might be something that you use at college or at school, but if not, if you can either just Google Mentimeter, there's an app, or go to mentimeter.com login, you will find a little app to log in, and we want you to, once you've done that, find the code, use the code that's on the screen here. So the code is 5381 5367. So I'm going to give you a couple of minutes to do that, because you perhaps weren't expecting to have to log in. But what we want you to do is to start to think about Mr. L, who we've just met, and we've talked about his condition, and we found out a little bit more about him and what he likes to do at home. We found out a little bit about his job and the medicines that he takes normally. So he takes those or uses those 2 inhalers to help with his COPD, his breathing condition. But we want you to think about if you were the pharmacist, so by using the word clinician, we mean if you were the pharmacist today, what would be the things that you were perhaps most concerned about? What are the most important things for you in terms of thinking about getting the care right for this patient? So when you're using Mentimeter and you've logged in, you should find that there's 3 little boxes, and in those boxes you can add a word or a phrase or a sentence about what you think is the most important thing as a pharmacist that you want this patient to do in terms of the either the advice or the treatment or things that we want to check. Brilliant. So as you start to think of things, and you might remember, say, Ryan's just been talking to you now about how important it is to make sure that we get the right antibiotic. Okay. Yeah, we want to make sure he gets better, don't we? So we had him, we had him in hospital. It was really, we wanted to treat him and make sure that we knew what the infection was, but then we wanted to get him home as soon as we can. Okay, great. So we've got things like maybe thinking about helping him to stop smoking. And Ryan again mentioned that 10 cigarettes a day might not sound like it's particularly a lot, but actually for somebody with this condition who is really suffering in terms of their breathing, then actually if we can improve that, then that makes a huge difference to their care. But we need to think about whether he's ready to make that decision or not. Okay, so what other things have we got there? We want patient safety, which is great. We want to get the right medicines to him, but we want to do it safely. So you'll notice again that Ryan talked about maybe swapping to the once a day capsule, because when we get him home, that means that the likelihood that there's less side effects for the patient. He's only taking it once a day, and hopefully that will reduce those things as well. Gosh, we've got loads of ideas. This is fantastic. So we're going to be concerned about, we've got medical history on there. Okay. We've got patient well-being, let's say patient safety, what medicines they currently take. Has anybody mentioned their inhalers? Yes. So we've got good inhalers there. So as Ryan said, we deliver medication using inhalers, but actually we need to think about not only does he take his medicine as it's been prescribed, but is he using those inhalers properly? And sometimes patients might have issues in terms of some inhalers are quite complicated to use. They can be quite difficult if you have something like arthritis, and they can actually be quite hard to coordinate as well when you're trying to use them. Wow, so loads and loads of ideas and thoughts on there. It's getting smaller and smaller, so it's getting less and less easy for me to see all of these ideas. Fab. Zena, can you see the answers on the screen as well? I don't know whether you can or not.
Yes, I can.
Is there anything that you'd like to pick out that I've perhaps mixed that have been coming through?
So I thought something that was quite important was a few people have mentioned about patient preference and his choice, and I thought that was quite important as well. That while we're making decisions as pharmacists and directing, what we want him to have the right antibiotics and the right inhaler control. We also need to remember that he's a person, and he's going to have some indications about what he wants as well. So engaging in those conversations. Ryan mentioned a very good point about looking at capsules and taking into account any patient preferences he has in the formulation of medication. So I thought those were really good points that you're starting to already think about the patient as a person and focusing on that. So that was lovely.
That's brilliant. Thanks, Zena. And actually that leads us really nicely into the next question that we're going to ask you, because one of the things that's really important as a pharmacist is that, there's the things that we know that we can do and that will really help this patient, but it needs to be the right thing for the patient. That it needs to be their choice. And some of you, as I say, have started to think about that. So can we have the next Mentimeter? So this time I want you to think about Mr. L. We met him earlier. What are the 3 things that you think might be the most important thing to the patient? And they might be a little bit different or they might be similar. So again, it's the same code and you don't need to do anything other than just start to add your ideas. Brilliant. Yeah, he's going to really be keen to get home, isn't he? He likes being at home. none of us like being in hospital, do we? We all like our own beds. We all want to be where he's familiar with us. Brilliant. Yeah, he might get out in the garden again, be with his budgies. I'm glad to see his wife's got a mention as well as his budgies as well, which is good. He wants to go home to his wife as well. Okay. So where you can see it quite large there, that you sort of all repeating similar ideas. So these are really key thoughts. So a lot of you are saying that actually just getting better and getting home is a real priority. Yeah, so short-term health, that's quite nice. So there's perhaps some short-term goals for the patient in terms of getting home and feeling a lot better. But there might be some longer goals as well. So some of you have talked about maintaining his health and also understanding his care. And as a pharmacist, you've got a really important role in terms of educating the patient about the choices that are available to them, and helping them consider the risks and the benefits from the medications that they might be offered, and getting them to think about which medicines might be the best for them and which approaches to their care. And sometimes we might not even be prescribing a medicine. It might be, making a different adjustment to make sure that they're getting the best in terms of quality of care. Brilliant. So someone's mentioned kindness, which is lovely. Yeah.
I was literally just going to mention that. I thought that was lovely. I really liked that. And also mentioning the wife. I mean, yes, of course, he'll want to be getting home. But when you are managing patients, there's also that expectation that you'll have interactions with their family. And understandably, they're going to be super concerned when they've got, a close relative in hospital. So it's also having those frank and honest conversations with families and taking into account that there's a lot of emotions. And so it's all part of the parcel of being a pharmacist and accommodating all of that. And so it's lovely that that's already being considered and thought about.
Lovely, thanks. So hopefully what this exercise has done is just get you to see that, it can be quite tricky sometimes because there are two agendas there. There's the agenda of the clinician and the agenda of the patient. And what we want to do whilst you're with us throughout the 4 years, and then when you go on to practice, is think about how do we work with our patients in terms of coming to a shared decision on the best approach and the treatment that we want to agree on in terms of patient care. So that was really kind of the purpose of introducing that. And thank you so much for your engagement. We've got all sorts of things there that we weren't necessarily expecting to see. So it's fantastic that you are really thinking about all of those different things as well. So Ryan has introduced us to some of the science that you will need in terms of achieving those clinical outcomes for the patient. So I'm thinking about the chemical structure. You looked at the chemistry there in terms of the antibiotic and where the weaknesses might be in that molecule and that structure. So your chemistry is really important when we're thinking about what to prescribe. We also thought about the organism that was causing the infection itself, and in that case it was the bacteria. And Ryan again introduced you to the idea of the microbiology and how we would test for that and find out what actually is causing that infection. And then also we talked about the importance of the physiology in terms of the pathophysiology in terms of the disease and its progression. So there are lots of things that you will need to consider. And what we want to kind of introduce you to next is to think about how do you work towards that shared decision approach, and how do we teach that to you. So we teach in a variety of different ways, and it will feel very different from school and college. So you'll often be working in small groups. It's not the slide I was expecting, but it's okay. I can just coming back. I was going to go. I think it's I've got Nina down next to come in just a moment. So what we're going to do is we're going to think about kind of how we teach you in workshops, how we would teach you in seminars and in lab sessions, but also sort of practical and experiential learning in terms of placements. So I'm going to introduce you now to my colleague, Dr. Nina Lakhani, who's the lead for our Interprofessional education programme. And she's going to give you a brief introduction into how that actually works. So we're going to hand over to Nina now. Hi.
Hi, everybody. Thank you, Helen. That was really good. And well done, Brian. I really enjoyed that. Every time I do this, I learn something different, which is really, really good. So I'm Dr. Nina Lakhani, and I am the school lead for our Interprofessional Education program. It's a very exciting program. We do it we do it in the very well at our School of Pharmacy. Very proud of it, and it's a world-renowned program as well. Next slide, please, Jyoti. Yeah, next slide, please. Next slide. Okay, so it says I need to forward them. Okay. I can't forward them, so I'll sorry about that. Okay, so this is the next slide. I'm so sorry about that. Right. So what is interprofessional education? It's when two students from two or more professions learn from, with, and about each other to enable effective collaboration and improve health. This is something that was very, very important in the World Health Organization, and it is a definition that has been used by all, so that we understand that the from, with, and about each other is very, very important. So why is it important for pharmacy? Well, we really need to prevent negative impacts of poorly integrated and delivered care. And we need people to know that we are not just shopkeepers. We are part of a multidisciplinary team. We are part of a multidisciplinary team, whether we work in a store or whether we work in a hospital or whether we work with GP practices. This is extremely important to remember, and it is important to instill right at the start so we can avoid really high profile cases such as the shipment report, such as the reports that we are seeing where cases have actually broken down, where people have not been talking to each other. So what do we actually learn with each other, with other students? So we learn to deliver health and social care that considers the whole individual and all aspects of their physical, mental, emotional, and social and cultural needs. It's a bit of a mouthful. Yes, I do understand that it's a bit of a mouthful, but it needs to be holistic. So right from the beginning, we need to make our students holistic healthcare professionals, and we look at the person as having multiple needs. We're not alone in this as pharmacists, but we know we're medicine experts. But we need to understand that other healthcare professionals are also involved in their care. So by learning together, we get the trust of the patient. For what we need is to know about them and make sure that they trust us. So who do we work with when we do this? So we are very fortunate at De Montfort University that we have also got another university in Leicester, and we bring all the students from both universities together on our IPE programs at different stages. So we collaborate with the University of Leicester and some of their students there, such as medicine and physiotherapy, and we also have all the other healthcare professional courses we do at De Montfort University, and bring you all together. And we get you to work together. We get you to talk to each other. It is very, very important, because even if we don't work together at the same time, you need to know what each other does, and we need to do that right at the start. So initially, you'll have a fantastic introduction to this whole plethora of students and work interprofessionally with them. That doesn't mean you just sit side by side and learn the same thing. You will interact with each other. And we do this with both face-to-face sessions as well as e-learning, and so we are also prepared for something like this in a pandemic. So what do we learn? We learn about knowledge of each other's roles and responsibilities. We learn about the patient. We learn about all sorts of things, but we do it together, including important skills such as communication, interpersonal. We discuss their roles and responsibilities. And also it's not just about communication, but it's also about conflict resolution. It's about person-centered care, and it's about developing the right attitude to respect diversity. And all these interpersonal skills are extremely important when you are working in a multidisciplinary team. So what do we do in pharmacy? Well, you start right at the start. So in year 1, we get you all together and we learn about teamwork and communication. So you will all be in different tables, not pharmacy on one table or anything like that. You will all be on different tables with other healthcare professionals like medicine, like speech and language therapy. So there'll be different students at your table, and you're going to start banter. You're going to start talking to each other. Then we ramp it up in year 2. We do a multidisciplinary case where a patient can come and talk to you, or you're given a patient case and you sit down and you don't solve the case, but you talk about this case. What are the complex structures of this case? It's beautiful, because what we see is we see this actual MDT people, the team actually form a team. You form a team, you storm in the team, you go away and you come out feeling really, really good. And then we put it up again in years 3 and 4 in an experiential learning style, where you actually go and talk to patients either in their own home or they come and talk to you. And that becomes really, really powerful, because then the Leicester model actually allows person-centered care. And this is what you're going to be doing when you actually qualify. So this is the Leicester model in action. You have a case study, your patient shares their case history with you, or you visit them. You sometimes have the pleasure of going into their home and you see their homes, and you get a real feel of what it's like to live in that sort of environment, and how you're using your medicines. And you do that with other healthcare professionals as well, who will ask their perspectives on the patient. You come back then to our colleges or our breakout rooms, and you analyze this case. You analyze and then give a presentation of the insights and possible actions you would do to improve this patient's life. And then you give feedback. And the patient sometimes looks at this feedback, is absolutely present at this feedback. In this case, our very nice patient Emma is giving feedback on her case and how you would improve their care. And then you either go around that circle again, or you come out of it truly recognizing what interdisciplinary working is all about. And that is really, really something else to see. So in conclusion, with interprofessional education, and I call this integration and collaboration. Interprofessional education is the way we do it. You will learn to be a global citizen because the program is global. We interact with students. You will be interacting with students from abroad as well as locally in order to do this. You will really have an insight because you will be doing things, and you will be doing things to have an impact. You will have a good grounding for your future career path. But most of all, you will have so much fun, because your future is bright. And I think, and we certainly at DMU think, our students are worth it. And that's me done, and I hope you enjoyed my talk.
Thanks, Nina. That's fantastic. So Nina's just given you a flavour of one of the types of placements that we offer, and we'll be happy to take any questions that you might have about the placements that we do offer. What I'm going to do now, though, is we're really sorry that we can't have you on campus at the moment and get the opportunity to have a look round. But we're in a really great position that one of our third-year students, Alex, has kindly come onto campus in a very COVID-secure way, and is going to give you a brief tour around some of the facilities that you're likely to use. So, albeit virtually, I'm going to hand over to Alex now. He's going to show you around the university.
Hello and welcome. I'm Alex, a third-year pharmacy student here at De Montfort University. I'm going to be showing you around some of our labs and facilities we use during your time here. Right now, we're in the formulation and compounding lab. So in first year, you'll be using this facility to make lotions, creams and ointments. Here we have all of the ingredients you'll be using to make these products, whether it's flavourings or glycerol that's used for viscosity, so making it the right consistency. Every time you have a practical, you'll be given information beforehand to set you up with what you're going to be doing. You'll come into the lab, put on a lab coat and find the equipment at your desk. It'll be set up so you'll have the basic equipment ready to go, a list of instructions for your practical and even the advanced setup for your materials. So whether it's analytical chemistry, so weighing up your ingredients at the right amount, or the right properties. I'll now show you some of our other facilities. Now we're in one of the microbiology labs. This is the sterile product room and hence why I'm dressed like this. This is one of my favourite spaces to use, and we use this when we're making things like syringes, IV bags and infusions. So here we have a really high-tech bit of equipment called isolators, and what we use these for is to make sure we're not harmed by the product and we're also not contaminating it, as it's going to be given to patients and we don't want to be giving them any bacteria that might be harmful to them. We also have some microbiology labs upstairs that are used for more generic microbiology practices like plating and identifying microorganisms. In your second year, you'll do a big identification project where you link your bacteria to a known disease. Now we'll be going over to our practice suite and showing you more of the clinical skills that you learn on the course. So now we're in one of our clinical practice suites. So you'll be in here right from year one, learning about symptoms, how to communicate with patients and how to give them the best care. From the start, you'll be learning things about symptoms of the eye, ear, nose and conditions like that. In this room, we have our consultation rooms. So as well as learning all of the knowledge to be a pharmacist, you're getting ready through role plays and communications to learn how to be the best pharmacist you can be. We're now in one of our other practice suites and our mock dispensary. When you come in for these sessions, you'll be given a range of patients and prescriptions. You'll come over to a dispensing station where you'll check if it's clinically appropriate for your patient and also if it's legally correct. You'll be given a load of resources from the BNF and BNF for Children to make sure that these are correct. Once you're happy that the prescription's safe, you'll come over to the dispensary where you can select tablets, capsules, antibiotics, and even controlled drugs. Once you've assembled your prescription and got it all prepared, you'll make your way over to the mock pharmacy. And you, as the pharmacist, will get to interact with an actor or lecturer and make sure you go through the counselling for your patient. I hope you've enjoyed this tour around some of the facilities you're going to be using during your time with us. We're now going to go back to Helen and the team for the rest of your session.
Thanks, Alex. So I really hope you enjoyed sort of virtually seeing some of the facilities that we've got to offer, and we really can't wait to get back onto campus and be teaching in those spaces again. So what I'm going to do now is just give you a little flavour of the programme and how you actually go from learning about being a pharmacist to qualifying as a pharmacist. So can I get my first slide, please? Brilliant. So the pharmacy programme takes you 4 years to complete. And so it's really a gradual building block, building on that experience. And we've talked about that. Nina mentioned experiential learning and developing on learning year on year. And Alex talked about the foundations there of what you learn in year one and building on that in years 2, 3 and 4. So our programme is accredited by the General Pharmaceutical Council. So if you want to do a pharmacy degree, then you have to be working under the regulatory body, the General Pharmaceutical Council. And there are specific standards that we need to work towards in terms of training you and making sure that you're ready to be a pharmacist at the end of actually 5 years, and I was explain 5 years, and going out into practice. And what you need to be able to do is demonstrate that you've got all of those skills so that you're ready to go out and start working with patients and patient care. So the four key areas that the GPHC are really concerned with in terms of learning and education, and that we will focus our programme on, are person-centred care and collaboration. So that brings us back to Mr. L, who we met earlier, thinking about the care for him, but working collaboratively with him to get the best outcome. Also, we'll think about professional practice, think about you as a leader and a manager. So these might be skills that you've never come across before and you've perhaps not thought about, but actually you as a pharmacist have a really, really important role in terms of making sure that you can lead your team safely, and you'll work with lots and lots of different people, okay, in terms of being a pharmacist within your team. You might have a dispenser, counter assistants, but likewise there'll be sort of wider teams. If you're working in perhaps a hospital setting, you're working with the consultants, with the nurses, etc. So really important there. And also the other part of the four key areas is education and research. So just to kind of give you a bit of background, in January 2021, the General Pharmaceutical Council looked at the standards of education for training for pharmacy professionals, and they were thinking about what you needed in terms of where you needed to be at the end of that 4 years. So you'll do 4 years with us at undergraduate level. You then graduate, and then you go on to do what we call a foundation year. So it's a year in training where you demonstrate all of those skills that you've learned, and you also sit an assessment at the end of those 4 years to again demonstrate that you are ready to practice as a pharmacist. And so what we'll be doing is we'll be working you towards in the future becoming a proficient independent prescriber, so prescribing the medicines as well as just dispensing the medicines and giving the advice. You've got a very important role now as a pharmacist in terms of prescribing the medicines, and you really are the experts in medicines after spending 5 years in your training. And so it's fantastic that you're getting the opportunity to use that now as well. Can I get the next slide, please? Lovely. So when you're with us here at the university, we've given you a flavour already. You know, we really work hard to integrate the science. So a lot of you choose pharmacy because you really enjoy your sciences. You enjoy the chemistry and the biology, and you think, well, what could I do with those sciences? But also you want to look after and care for patients, and you've got an interest there, and it sits nicely together. And so we'll integrate that learning for you. As I said, our programme is accredited by the General Pharmaceutical Council, and we've worked really hard to make sure that you get these opportunities to learn with patients at the centre of your learning, be it a virtual patient or a patient that actually attends one of the placement settings that you have, and start to think about clinical reasoning and decision making when it comes to prescribing as well. And Nina's already given you a flavour in terms of IPE and what that might mean for you as well when you're with us. Now, on one of the slide here, you can see a little wheel, and we'll share this with you after today. But these are the 9 standards that pharmacy professionals are expected to adhere to. So I think one of the things that's very different for you when you're joining a pharmacy degree is that you're actually it's a vocational degree, and you're actually joining a professional programme. So the way you behave within that, and the way the sort of the behaviours that you need to demonstrate are quite specific, because you're going to be a pharmacy professional. So on the slide here, and again, I don't expect you to be able to see this in detail, and you don't need to, but the things that the GPHC expect you to do is to be able to use your professional judgment in making a decision, to be able to demonstrate that you behave in a professional way, that you can work in partnership with other people, so other healthcare professionals. And there are other words on there such as patient-centred care and leadership. So it's about putting that knowledge into practice, and then making sure that, as I say, we're getting the best outcomes for the patients as we're learning throughout those 4 years that you're with us. So that's a little bit about the programme, and we're happy, as Professor Walsh said at the start of the session, really happy to take any questions about specifics in the programme, and we'll answer them as best we can, because there might be lots of things that you're thinking about. But what we want to do now is just introduce you to, okay, I've done my 4 years and I've done my foundation year and I'm a pharmacist now. Where am I going to work? What am I going to do? What's going to be my career pathway? And one of the things that I think is really fantastic about a career in pharmacy is it can take you in many, many directions. Okay. And so that's really one of the things that we want to kind of give you a little flavour for now as well. Okay, so I'm going to start by, we've got some short videos, and then Zeenat and Nargis are going to come in and also share their journey with you as well. So to begin with, can we just see the video from Mo, please?
Hi, my name is Mohammed Collier, and I am a graduate of the MPharm program at De Montfort University. I graduated in 2008. Seems a bit scary saying that, but I still have many fond memories and I still remember much of it today. Currently, I'm superintendent of Knights Pharmacy. My time at the Faculty of Health and Life Sciences taught me how to be innovative, how to think outside the box, how to take regulation seriously in respect of ethics, and of course, how to have the confidence to be able to make key decisions. And today, I still have difficulty sometimes making those key decisions, and so many years on, I still ask some of my tutors for support. And it's incredible to have that relationship many years on. And I don't know of any other schools of pharmacy that have that type of relationship with their students. It makes me really proud from where my journey started to where I am today. But that couldn't have been done without the support of my tutors, my colleagues, and the relationships I built at De Montfort University. And I continue to do so. Today, De Montfort University is helping support many of our pharmacists through postgraduate education, through clinical diplomas and independent prescribing courses, so that we're ready and we're prepared for the future of community pharmacy, which is a vastly more clinical outlook. And through the support De Montfort University has given, we've actually started our first healthcare clinics. We have set up 4 COVID vaccination sites nationally and are supporting in the national effort. So our postgraduate educated pharmacists are at the front line of care, changing the scene for community pharmacy. And it all started with the education that we were given at De Montfort University. The journey just doesn't end after your MPharm program. The journey continues. And as alumni, we are here to help and support anyone in terms of the decisions that they make and provide opportunities for their future.
So that was Mo Collier there that's speaking to you. So just a little bit of background. So Mo was my pre-registration trainee many years ago. So I'm a pharmacist by background and worked in community pharmacy. And Mo was one of my last trainees that I worked with. So it's fantastic to see him doing so well now. And brilliant. And I think many of the people here today will know Mo and have maybe taught him as well. But it's lovely to actually hear his story and his message. So moving on next, I think it's going to be Nargis who's just going to give us a little taster for her career as well.
Hi everyone, my name is Nargis. I apologise if my voice goes. I'm fasting at the moment, so Ramadan Mubarak to all of those who are fasting as well. So I'm a DMU graduate. I qualified 20 years ago. Yes, and it really has been that long. After a couple of years of real world experience, I returned to study for a clinical diploma. And now for almost 3 years, I've been working with a postgraduate pharmacy team, supporting the development and education of qualified pharmacists. I didn't dream of becoming an academic, and it wasn't on my personal development plan. I just took the opportunities that came my way, even if they initially scared me. I was the first female in my family to go to university, and whilst my colleagues may not believe it, I was a shy student. My advice is to never underestimate what you're capable of achieving, and don't narrow your vision. I've worked in community pharmacy and hospital outpatient pharmacy. And whilst working, I also got involved in supporting the teaching of undergraduate students at the University of Nottingham, which I've been doing for over 10 years. All my roles in some way have involved supporting the development of others, so I guess ending up in my current role at DMU is not that surprising. Learning truly never stops, and now in my 40s, I've undertaken a research internship, which has led me to contribute to publications and present at an international conference. This has ignited a passion to work towards reducing health inequalities and to influence positive change within healthcare and education. The pandemic has certainly highlighted how crucial pharmacists are to the UK healthcare workforce. Pharmacy is a very humble profession, but one with many opportunities and possibilities. You really can take it in whichever direction you want to. Some people have a particular career path in mind, but for me, I like the unknown, to embrace the freedom and to say, why not? Pharmacy has taken me on journeys I never imagined. Like many other pharmacies, when I qualified, I truly believed I could change the world. Well, the world of pharmacy anyway. Then reality hits and you realise it isn't that easy. But being back at DMU, that drive and self-belief is back. I'm surrounded by a supportive team and have access to expertise within the wider university. We want our students to aspire to become future leaders of the profession. And at DMU, we're here to support you on that journey. It's an exciting time for pharmacy, so whatever you decide, I wish you well.
Thanks, Nargis. That's so great to hear. And I think, like you, my journey, I've moved in many directions. I think probably, again, naturally, was going to always end up in academia of some sort in terms of that kind of teaching and nurturing that way. But that's fantastic. Thank you so much for sharing that. So you've already seen Zinat already. She joined me earlier when we were working on Mentimeter questions. So Zinat's going to join us now and just give us a little overview of her career pathway. Thanks, Zinat.
Thank you, Helen. Hi, everybody. Thank you so much for joining us today. I hope you've really enjoyed everything that we've gone through so far. I just want to say, Helen, next time, let me go on before Nargis, because that's a tough act to follow. But what I'll do is I'll just sort of briefly talk you through my journey so far, and you'll kind of see that I have like a love for DMU once I do that. So I qualified in 2015, so it's been around 6 years now. And I did my undergraduate at DMU. So I initially did that, and I wasn't sure what path to take when I first qualified as a pharmacist. I felt like community pharmacy would be the place that I felt most comfortable with, and so that's what I initially started doing. But I got provided with a very random opportunity to start working within a general practice, and I took that opportunity up with both hands, and I decided to delve into that, and it was such a unique experience. Just because the practice at the time had never had a pharmacist work for them. I'd just been a pharmacist that had been qualified for 8 months, so I just about knew what I was doing in that side of things. And we were just learning from one another, and it was such an incredible process that helped me grow so much as a professional. And during that entire process, I decided to come back to DMU and do my postgraduate clinical pharmacy diploma. And I decided to do independent prescribing as part of that. So I became an independent prescriber, focusing on COPD, which hopefully you're a bit more familiar with after Ryan's talk earlier on today. And I started using that opportunity for actually taking on much more of a patient-facing role and managing chronic disease areas, and setting up my own clinics. Seeing my name on a doctor's door was like a mind-blowing experience when it first happened. But it was just, again, a journey which I didn't expect. But to be honest, something that I had thought about from an undergraduate level was academia. And that was truly where my heart did lie, even though maybe I didn't think that was something that I could possibly aspire to at the time. But fortunately, I had some opportunities open up, and I am now a senior lecturer in postgraduate clinical pharmacy, focusing on teaching independent prescribing of all things. So it's come back quite full circle. And so to think a decade ago, I was preparing for my first year MPharm exams, pretty much right now, is just crazy. And I know, I'm sure at the moment, anyone listening is thinking, oh, that's so far in the future. But you know what? It does go by really fast. It's such an amazing experience. Seeing Alex's video where he, went through the compounding and all of those aspects of undergraduate life at DMU, the amazing supportive staff is just so incredible. So I hope you genuinely enjoyed the journey that you're about to embark on. I know I've loved it, and I'm sure you will too. So best of luck. Thanks.
Thanks, Zinat. That's great. So we've just got another short video again from one of our alumni, again, and giving you a little taste or a flavour of another direction that your career might take you. And so I think it's Kishan now that's going to be on the next video.
Hi, my name is Kishan Karia, and I'll be talking today a little bit about my experiences of doing undergraduate and postgraduate studies in pharmacy at De Montfort University. It's been a while since I was an undergraduate student, but I have to say, whilst I was studying, I had lots and lots of conversations with lecturers and tutors. They were all very welcoming, they were respectful of your questions, they respected you as a person, and they had multiple ways of getting in touch. So you could phone them, you could email them, get to speak to them in person. The tutors and lecturers were very approachable and friendly, and I have experienced the same with my more recent postgraduate studies too. Looking at what skills I've developed and how that's impacted on my career, I had a great time studying, and it really helped build my confidence to work in real life situations. Everything that was taught was not limited to academic or clinical material. We had other interprofessional education, learning in practice. So we had placements for 2 weeks in hospital, amongst other places. And all those little bits help shape you as a working professional. The things that I've learned have been vital for my work. As pharmacists, we see patients all the time. We work with multidisciplinary teams, we work with healthcare professionals, and the things that I've learned have really helped me build my confidence. They've helped me build relationships and act in a professional manner with the people that I work with. In my new role, I knew that I was in new territory, and I knew that I would benefit from doing some further education. So I joined up to do the postgraduate diploma in clinical pharmacy. Alongside that, I also did a 18-month CPPE pathway. The courses have really helped me massively in my roles. The tutors and the lecturers, again, they've been very supportive, approachable, and you can also have a bit of a laugh with them as well, which is also very nice.
Oh, that's fantastic. So we're really grateful for Mo and Kishan taking the time just to send those videos across to us. Sorry that they couldn't be with you in person today, but it's great that you've had the opportunity to hear from them as well. So we've kind of come to the end of sort of giving you a little flavour in terms of what you might expect here at the university. But we're really happy to take some of your questions now, and I'm going to be joined by the rest of the team as well that have joined me today to sort of answer those questions. So yeah, it's over to you really. Let's hear what questions you might have. Oh, lovely, thanks. So we've got a question from Annabelle. So we will be able to prescribe when we finish MPharm, or will we have to do a separate independent prescribing course after that? Who would like to take that question? I'm happy to, but if anyone else would like to take that question, maybe. Do you want me to jump in, and then maybe postgrad, if you want to just talk a little bit about IP, if we can lead into that, that'd be great. So at the moment, Annabelle, when you join us at the moment, you won't end at the end of the 5 years as an independent prescriber. So what there would be is there'd be a transition period from you qualifying as a pharmacist to then beginning your independent prescribing course. But what the programme will do is make sure that you have those skills that you need in terms of being ready to be a prescriber. So those kind of clinical reasoning and decision-making skills, the diagnostic skills and the prescribing skills. At the university, we also, as part of our postgraduate team, actually have an independent prescribing course. So I don't know whether either Zina or Nargis wants to just come in and talk a little bit about that as well.
Yeah, sure. I can come in and talk about the independent prescribing course. So the IP course at DMU sits within a wider postgraduate clinical pharmacy program. So it can either be taken as a standalone 45 credit module, or it can be taken as part of a 2-year diploma or a 3-year master's. And essentially, it's a course that pharmacists can enroll onto once they have been qualified for at least 2 years and have 2 years post-qualification experience. And as part of that course, what they're expected to do is spend some time with a prescribing mentor in real practice, so be in hospital or GP land, and also develop some skills through the university, and some of the skills Helen's already mentioned, so clinical reasoning, consultation skills, clinical examination skills, to further their practice as a potential prescriber. And essentially they would focus on a particular therapeutic area, become super awesome in that area, and then hopefully qualify as a prescriber and start working within that context. And then once they become fully competent within that context and they're happy to, they can continue to expand to other therapeutic areas and start practicing within them also.
Thanks, that's great. Have we got another question? So a question about foundation year. Susie, perhaps that's one you'd like to take.
Yeah, happy to. Thanks, Helen. So yeah, thanks, Mohammed. It's a really good question. So we offer several different routes in via foundation, some for international students and some for home students, and they're both taught by our on-site partner college, DMU IC, and I'm the academic lead for that as well. So hopefully I'll be able to answer your questions. So in order to progress, you need to get 60% average with 65% in both in modules Chemistry 1 and Chemistry 2. And that's the same for the Overseas Foundation, which includes English for academic purposes, and the Home Foundation, which includes some extra modules in things like psychology and microbiology, my subject as well, instead. So yeah, most of the students, actually last year we had a really high progression rate. I believe it was around 80-90%. The year before it was a bit lower, around 50%. So we're kind of learning as we go along. I think this will be the third year of that program coming across as home students. So you've got a really good chance of getting in, but it's really up to you. So if you work hard, there's no limit on the number of students that progress from foundation. If you work hard and you achieve the grades, then absolutely you will progress then into year 1 of the MPharm. Good news on that as well, because you get all your selection event, your interviews out of the way before entry. So it's really just the academic criteria that you're working on. And we've got some fantastic people over there. They use all the same labs that we use in our buildings. It's taught by my friend Gibran. He's really nice. He's the head of science over there, and we work very closely together. So hopefully that's helped you. But yes, if you don't make it, let's not go there yet. But if you don't, then there are other options. We have other pathways you can go on to. So you could join pharmaceutical and cosmetic science as long as you pass. So that would just be 40% across the board, kind of passing the year 0 foundation kind of level 3 program. And then you would get a second chance at getting back into pharmacy from that if you wanted, because we do have a transfer route back in. Obviously you're racking up a couple of years there, so you do have to bear that in mind, but there are other options. It's not kind of not a no forever, but PCS, or pharmaceutical and cosmetic science, is a great program. It's really more about the kind of the behind the scenes designing, formulation, communicating about kind of medicines, working in regulatory affairs, those kind of aspects. The big difference from pharmacy is obviously pharmacy is very patient focused, patient facing. So this is more of the behind the scenes R&D role. So some great things you can be involved with healthcare and helping patients, but less directly if you want to too. And we do find some students actually start the foundation, then change their mind and then decide, no, I'd rather do the other role. So happy to discuss in more detail if needed.
Thanks, Susie, that's great. Oh, I've got another question here then. So about the DMU Global Programme. Do you want to start with that, Susie, and I'll jump in?
Yeah, I mean, absolutely. So DMU does have a global program that has historically helped students to kind of have overseas experiences. And myself and Helen have been involved in this. I've taken students out to Hong Kong on a couple of occasions, and also to New Orleans, to the world's biggest microbiology conference, which is great fun for me. And I think they really enjoyed it too. We saw the oldest pharmacy in New Orleans and one of the oldest in America. And we had fantastic experience out in Hong Kong, learning about herbal medicines and how that kind of the teaching of that is complementary to the teaching of traditional kind of more Western medicine as well. I think we do have to bear in mind, though, obviously with the COVID situation, all of that has been put on hold. And it's likely for next year as well that will be severely impacted, and we're not sure about the kind of long-term aspects of that. So it may be that we have to do more kind of virtual events and internationalize the way we teach rather than offering those experiences. Do you think that's fair, Helen? Anything you want to add about your experiences or the future?
Yeah, I think that's really fair. And yeah, so in terms of trips that I've been lucky enough to take forward, we went out to New York. I used to work for Boots Walgreens, so I had some contacts there, and that gave us the opportunity to visit 3 different types of pharmacy in New York, and learn about how you qualify as a pharmacist in America and how it's different to here in the UK. So really great. It was a really great opportunity. But I think this year, because we haven't been able to travel, the university has worked really hard to still offer a global opportunity, and there's been some really fantastic online courses, in particular linking into the UN Sustainable Goals, which is a really important part of our kind of vision and mission as a university in terms of what we can give back in terms of sustainability. And I know that my personal tutees who've been involved in that have really enjoyed that opportunity. So there are other ways of working, and fingers crossed that we'll at least see some kind of opening up of other opportunities depending on kind of what happens moving forward. Lovely. Next question. Okay. So in terms of facilities, not sure exactly what you mean by limitations and specific times, so I'll try and answer it as best I can, and please do come back in if we've not answered your question. But so things like the library facilities and a lot of the campus facilities, they are really flexible in terms of accessibility and being open. So in normal times, the library is open 24/7, it's kind of 365 days of the year, so you can access that study space, which is fantastic. And I know students are often night owls, and you like to work at very strange times of the day and send me emails at 2 and 3 o'clock in the morning, but that's great, so that you have that opportunity to use that. So in terms of the library facilities, for example, really great facilities. We have a lot of online resources as well. The library's worked brilliantly in this situation, offering live webinars, live chats, still that same opportunity in terms of supporting with coursework, helping with perhaps referencing or structuring an essay, for example. So all of that's still there. In terms of the opportunity on campus, so you will all get an equal opportunity in terms of the practical sessions that you have, and we try and teach in relatively small group sessions. Some of the labs are slightly larger, and perhaps Susie, you'll sort of talk through some of the lab opportunities. But when it comes to the sessions in terms of consultation skills and dispensing skills and clinical decision making and reasoning, we tend to work in smaller groups, workshops of maybe 20 students. So it gives you the opportunity to have really good kind of one-to-one interaction as a team. But do you want to talk a little bit about the practical labs, Susie?
Yeah, sure. I mean, I suppose one thing where we're a bit different from some other universities is our lab sizes. So we normally teach lab sizes in 40 maximum for a big lab, which is quite small actually for a university. So you do really get that chance to come up, and maybe if I was leading it, or Ryan or Helen or someone, come up and chat to us and talk to the lecturer. Sometimes we'll have a postgraduate student or another lecturer with us helping as well. So we can really get around and talk to all of you. In terms of the timetable, yes, the students all have a timetable. You all do the same practicals, all have the same opportunities all the way through the course. But it's worth saying that the timetable is kind of different for everyone, and it's different every week. So you get that at the beginning. It's on an app, and you can see, you kind of plan what you're going to do for the year, but you kind of need to plan a bit ahead if you're thinking of working or doing other things too. Practicals, well, you start right at the beginning. In the first year, you do microbiology, you do compounding, so adding kind of lots of things together to make actual medicines rather than just kind of compounds or crystals of drugs, making them into medicines that the patient can use. And you do that right from the sign of week 1 or 2 of the course. I think similar, Helen and Ryan, with practice as well. They start really early, I think, with dispensing, don't they? So get some really good hands-on experience, sort of applied to pharmacy, feel like you're applying the science from the start. That's our aim anyway.
Thanks. I think I've got some more questions. I can see them coming through. So more about prescribing.
I can take that one. So Annabelle, yes, at the moment, it's a requirement by the GPHC that you do wait, you have 2 years of post-qualification experience before you can start an independent prescribing course. And the rationale there is, initially, in terms of how it's structured at the moment, there's still time for you to initially start learning how to be a pharmacist without the added sort of considerations of prescribing decisions that need to be made. But everyone's journey is very different in terms of when they decide to pursue prescribing. I did mine relatively quickly, so as soon as I hit that 2-year mark. But in terms of my student profile at the moment, I have students that are almost like 60 or in their late 50s, and I have students who are fresh out of their 2 years post qualification. So everyone does take it at different times, and in fact I think Ryan's also a prescriber, so he may want to pitch in with his own little journey.
Yes, no, I'm a prescriber as well, and Zena, like you said, everyone's got a different journey, and I think some students may feel maybe hard done to that they're not going to finish the whole training or initial training program as a prescriber. But my advice to you is don't be in a rush to be a prescriber. So once you've qualified, as Zena said, you'll spend time kind of developing and strengthening your skills as a pharmacist and really seeing how patients use medicines and how patients react to medicines and how medicines can have different effects on patients. And that's a really important experience to have if you're going to be prescribing medicines. And as you become more experienced as a pharmacist and you might develop an interest, you probably might be grateful that you've not been a prescriber from day one, and you're being asked to prescribe the kind of the basic stuff like your paracetamols and your blood pressure medicines. I did my prescribing once I'd kind of settled into a specialism of infectious diseases, and now I'm looked upon by consultants and medical teams to go and review really complex patients, and I'll be prescribing complex anti-infective medicines and therapies that require a lot of monitoring, a lot of follow-up. I'll be importing medicines from America because they're not available in the UK, and I, as a pharmacist with a specialism, have the skills to do that. And my advice is, don't be too hasty to jump in and be a prescriber. Think about what your unique selling point is as a pharmacist and deliver that. So like Nargis was saying, pharmacists really have the ability to lead on the use of medicines and lead on patient care, and prescribing is a great way for pharmacists to do that. So.
Thanks both. So what can we do in the summer to prepare for the course? So I think if you can get work experience, that's always great, and you might need to consider whether you are happy to just do some volunteering work, so unpaid work, but any experience that you can get in a pharmacy setting would be great. And I would, as being in a community pharmacy setting and kind of having lots of requests for placements, what I would say is have a really good CV, maybe a covering letter as well, and go in with it in person, and hand it over and introduce yourself and just say, I'm going to be a pharmacy student, I'm looking for some work experience. And the majority of the people that I took on were people that did that proactively. When I used to get so many through the post that it was really, you'd open it and think, oh yeah, I'll go back to that and put it on one side. But if someone comes in, it really makes an impression. So have a really good CV and see if you can get some work experience. Don't worry if you can't. Now we are in different times at the moment. Social distancing within the pharmacy setting can make it harder for you to go in and volunteer. And, as we've had waves with the pandemic, sometimes it's easier to be in the pharmacy than to have people in other times. So don't worry if you can't get that. I think the other thing that I would recommend is just have an interest in pharmacy in general. So look at the news. There's news stories all the time that relate to healthcare or to pharmacy specifically. There was a news article earlier in the last week or so about the development of a new malaria vaccine, for example. So there are lots of things that you can be reading about that give you an interest in the subject area. So think of different ways that you can gain experience. And if you are with us on the programme, we will send you some recommended kind of reading and sites to look at as well before you join us. Does anybody else want to add anything that I think people could do in terms of preparing?
My advice to students is it is an intense course. You can be quite busy, so take the opportunity to have a break. Okay, so you're going to be having exams at the minute, and then you're going to be starting with us in October, and it can be quite university is very different to college and school. So have an opportunity to have a break. I know we probably can't go abroad because of coronavirus, but have a staycation, go and see friends, go camping, do something. Try not to be too worried about prepping for the course. But like Helen said, there's plenty of news articles out there. There's some good pharmacy magazines. So there's one called Pharmacy Magazine, funnily enough, and then there's Chemist and Druggist, and the Pharmaceutical Journal have some good news listens on them, just to kind of give you an idea about kind of what's going on in the profession.
Yeah, I agree, Ryan. I mean, I wouldn't over worry, and I think sometimes students worry that maybe their A-level choices won't be the same as some others and they'll be behind. If you haven't studied A-level biology, for example, if you did want to read up or get a textbook, that's fine, but you don't have to. We will be starting from the beginning, and we'll be doing subjects like microbiology that the majority of students won't have studied at school or college at that detail. So really don't worry, as long as you you apply yourself when you come, you work hard, you attend everything. That's really important, to attend as much as you can. Then I'm sure you'll do really well. I think those are the things we see that help people succeed, Helen.
Absolutely. Yeah. Great. Let's take another question. Oh, exams. Everyone always wants to know about the exams.
Happy days.
Happy days. I know. So we'll just talk you through the exams. So in the first 3 year, your exam structure is really similar. So you will have a piece of coursework in each module that you do, and that might be it could be a clinical care plan, it might be a poster presentation, it could be the lab report that Alex talked about when he was talking about the microbiology identification project. So there's a piece of coursework that you would do. We also assess you using multiple choice questions, be it either kind of just checking your understanding of knowledge or your application of knowledge as well. And then finally, we use something called OSCEs, which are a practical-based assessment, and that offers you the opportunity to work virtually and to consider a consultation with the patient. So we might have Mr. L, as we've got today, and we are checking that he can use his inhalers correctly. So he might demonstrate how he's using the inhaler, or we might be demonstrating to him how to use the inhaler. And we use that format of assessment as well. Would anyone like to add to the sort of assessment experience?
Well, I suppose I could say a bit about the practicals, couldn't I? I think Alex talked a bit about the microbiology that we do. We do some other great fun stuff too as well. So where he first was in the video, our student Alex, he showed you the compounding lab. And you get to make some products and learn how to do that and report that on a sheet. And then you're marked after you've learned how to do it. You're not kind of assessed on that to begin with, and then you're assessed kind of in a practical situation, learning those skills. So you'll make a product, you'll fill in the sheet, and you get marked on the accuracy of that and how well labeled, etc., your product is. Then when you go into microbiology, we'll give you an unknown microorganism. We've got a big load of them, and you won't know what it is. Hopefully I will. And you'll go away, you do lots of different tests on it over the course of a few weeks. So we give you a guide for that, and you follow through each week. So 1 week you might do microscopy, next week you'll do kind of what they look like on an agar plate, then sort of how they grow with different sugars, what reactions they have. And then you gather all that information together, and you put that into a little online bespoke program that we've written, and it will give you feedback. So some of the marks are on how kind of well you've done with the tests, the practical work. But then later on, what we ask you to do is take that information, we tell you the right answers, and you have to go through kind of a key to work out what organism you think this patient might have. And then you have to write a bit of a reflection on it. So think, well, okay, if the patient had this organism, what kind of antibiotics would we use? What would be our first choice? And like we had with the patient scenario with Ryan, what would we do if that wasn't working and we found out that there was resistance or something happening? So I hope that gives you an idea. Ryan, you got anything to add on the OSCEs or any of the practice scenarios?
So yes, I mean, like Helen was saying, the OSCEs can be a range of things. So it could be that you're working in a community pharmacy, the patient comes in and goes, I'd like this medicine, and you've got to have a conversation with them to see whether that's appropriate and give them relevant advice, through to more complex things later on where you might be placed in a GP setting, or let's say an infectious diseases clinic, and a patient comes to you and goes, I think I've got this disease, and you've got to then do a little bit of a discussion to find out whether it's something you as the pharmacist can deal with, or whether it's something you need to refer to another profession, for example. And like Susie was saying, not all of the assessments are kind of an exam or a written exam. So you might get assessed through presentations. So you might do patient case presentations, or you might do kind of decision-making presentations. You might be given a problem or a scenario, and you've got to go away and think about how you'd approach that, what your options are and why, and then present that and essentially defend your decisions. You might be asked different questions about your decisions. And then you might also do what we call pharmaceutical care plans. So it's something we often do in our heads as pharmacists and go, right, this patient's got this disease, let's give them that medicine. But if that doesn't work, what do we do? If we give them that one, what do we have to do in terms of monitoring, make sure it's safe? So we might get you to essentially write that down as a mini report or on a pro forma, and that can form part of your assessment as well. So I think that's one thing we do really well at DMU. We don't just give you a MCQ or written paper exam and go, that's the only assessment opportunity you have, because we know that people don't always perform the best in those scenarios. So we give you lots of different ways to prove and show your skills, particularly on the practical skills. And one thing I like that we do throughout the course is we get you to do poster presentations as well. So it's about communicating information in different ways, and we'll assess you on that as well. So.
Fab, thanks. Have we got any more? I think we're running low on time. Okay, we've got another question just about year zero and the application, Susie.
Yeah, fantastic. Thanks. I can do the quick version on this. The answer is no. So when you get an offer for the year zero on UCAS, that's B231 rather than B230. It's an integrated offer for the whole degree. So not just the year zero, the next 4 years of the MPharm after that. So 5 years in total. So no, you don't reapply. You're applying for the whole programme.
Thanks, Susie. See if we can just take a couple more questions before we close. We've done I think we've done sort of topics and reading up on the summer. And say we will send some information out. Brilliant. Okay. GP placements. Nina, that's got your name on it.
Okay. So yes, Annabelle, good question. Are there specific GP placements we can go on? We have a whole program to do that. So when you come to our 4th year, we've got a very, very nice program which is called GPEP, which is the GP education placement for pharmacists. And this is when you actually go into a GP practice. It's a blended learning program, so there's some e-sessions, but you actually go into GP practices where you will observe their consultations. You will learn about their systems. You will learn with the clinical pharmacists who are working at the GP practice. You will also be interviewing patients for your pharmaceutical care plan. This is something that we're very, very proud of. We do it in collaboration with local GPs and the Leicestershire and Leicester Training Hub. And our GPs really love to have our pharmacy students. So yes is the big answer. It gives you a great introduction into how to work in GP practices, and it has been extremely well evaluated. We're very, very proud of it. So it's a good question, Annabelle. You certainly will get some experience, even if it's starting a little bit late, because we give you a gentle introduction into clinical practice with our hospital programs, and then we build it up into GP placements in years 3 and 4.
Thanks, Nina. That's great. So I think we're going to have to wrap up the questions there. Thank you so much for all of your questions. I think we could have carried on a little bit longer, but thanks so much for asking those questions. So just going to kind of move on to a summary and close. And first of all, I just want to thank everyone who's joined me today and taken time out of their afternoon to join us and answer the questions and sort of share their stories that they have as well. Susie, what's the best way of students getting any extra questions to us that they might want to ask after today?
Oh, well, we have kind of online inquiries. They can always email admissions@dmu.ac.uk, but I expect we'll be able to put something up. There we go. I spoke too soon. HLSmarketing@dmu.ac.uk, and our great team there will get back to you. And if they can't answer anything, they'll forward it on to us as the team. So yeah, always good to have questions. Don't feel worried about contacting us. That's what we're there for.
That's fantastic. So I think we're drawing to a close now. There's a question just gone into the chat, Susie. I don't know if we've got time to just, probably won't be able to put it up on the screen, but it's just come up from Aisha.
Oh, admissions question. I like one of those. Yeah. So if pharmacy is my insurance choice, will I have a place saved on it in case I don't meet my kind of first choice? I think that's kind of going with. The answer is if you meet the terms of the offer exactly, and your first choice doesn't take you, then yes, legally we are bound to take you, and we will. If you slightly miss our offer, of course, then it will be more, well, if there's space, we'll take you, but we will try to if we possibly can. And if not, we will offer you an alternate course if appropriate with a route back onto pharmacy. But fingers crossed that won't happen, Aisha. So don't worry too much. But yes, we will try our best to take the students who purchase firm first, then insurance. But if you meet the terms of the offer and your firm doesn't take you, you don't meet their offer, yes, you will have a place with us.
Thanks, Susie. So again, thanks. All I would like to say is thanks so much for joining us. Thank you for your participation. We've had some great questions. You came up with some fantastic ideas in the Mentimeter session as well. We hope that you found today helpful, and it's just given you a little bit of a taster as to what it would be like here at DMU. But please use those contact addresses and get back in touch with us if there's any other information that you want. So thanks everyone for joining us today.
Thanks everyone. Bye.